Prolotherapy can be used to treat a number of things where ligaments, tendons, capsules of joints, and fascial structures which surround the muscles attach. Most causes of lower back pain are due to those structures being injured. I know a lot of people get all excited because they think they've ruptured a disc and they have a sciatica, they call it, and that surgery will help. But surgery only helps about 10% of the time. Prolotherapy can help in the other cases, and it doesn't help to strengthen that part of the body when it's injured. It has to be fixed first, and then the exercise takes place. And the physical therapists seem to have that backwards. But that's, again, a product of training. They get trained that way, doctors get trained that way, and it's just not, it's incorrect, and it needs to change. Prolotherapy has a place in medicine, but it hasn't been accepted because of the opposition from the orthopedic surgery organizations. What it does is most important. It creates an osmotic gradient whereby the cells rupture and release their contents into the area, and those particular cells have growth factors that are released, and it grows exactly the type tissue that's in that area. That's how it works so well. Typically, I have to do 3 to 6 of these injections over a period of time. I typically have the patient come back at 3-week intervals, so it's possible that a patient will get 1 injection and the area will heal. I've had some patients up to 8 times. So it depends on the patient, it depends upon their hormonal status. That's how I got into hormone replacement in the first place. I started discovering how healing was affected by low hormones. A more recent use of platelet-rich plasma has been introduced. Platelet-rich plasma is where the patient's blood is withdrawn, it's spun, and the platelets are re-injected into the patient. It releases growth factors and causes the growth of native tissue at that area. So it's very similar to prolotherapy, but it's different. And being that we got away from the use of the word prolotherapy, it seems to be accepted a lot better, even though it does basically the same thing.